Overdiagnosing of schizophrenia in Black Americans is a longstanding issue where they are diagnosed at least 2 times more and sometimes up to 3 to 4 times more than the general population with schizophrenia versus bipolar. And there are lots of biases that happen if we don't understand someone's culture. Sitting on the other side of the table, we might misinterpret or misunderstand what someone's experiencing if we're not culturally competent or culturally sensitive. There is implicit bias that goes into the diagnosing of Black Americans that lends them to end with the diagnosis of schizophrenia versus bipolar, which is really important because diagnosis guides the treatment. And so if we don't get the diagnosis right, we don't actually put people on a treatment plan and regimen that really is going to give them the best chance to resume their normal functioning. The main distinction between schizophrenia and bipolar disorder is that bipolar disorder is a mood disorder that really has an episodic nature, whereas schizophrenia is a pretty chronic, persistent illness that doesn't have the ups and downs in terms of highs and lows. A manic episode is often easy to identify in that it has pretty classic symptoms. There's often an elevated mood or an expansive mood. There's often a lack of need for sleep. There is an increase in goal-directed behavior. There's typically some agitation or restlessness, and you can often also see irritability. Other reasons why schizophrenia could be overdiagnosed or misdiagnosed in Black Americans could be related to their hesitancy to disclose symptoms to caregivers. That could be due to their mistrust in the medical system. It could be also due to the fact that there's not a workforce in mental health that is diverse from an ethnic standpoint or a cultural standpoint. And all of these things make it difficult for some patients to be able to talk freely. And sometimes the hesitation or the reserved nature might come across as paranoia, and sometimes paranoia can be attributed as a sign or symptom of schizophrenia. There's also sometimes a lack of cultural competence and sensitivity as it relates to healthcare workers, and so someone might overrepresent or overemphasize symptoms that someone is reporting, or maybe even think of something as a symptom that might not be a symptom. So for instance, if you're living in a neighborhood that is unsafe, that there's a lot of violence, and you speak to the fact that you're nervous, you're afraid, someone who's not culturally competent or culturally sensitive might attribute that as something that is paranoia as opposed to something that is just their real life experiences.